Yesterday we were talking about nerve degeneration meridian, central nervous system, out of which the peripheral nervous system comes out, autonomic nervous system, which includes all the motor nerves, all the sensory nerves, everything, voluntary, involuntary, everything. Many kinds of degeneration, many kinds of, even in case of hemorrhage, hematoma, white matter malacia, red matter malacia, all that you can use it. So you can use it for brain, you can use it for spinal cord, and you can also use it for your limbs and what bodies. For everything you can use. 1, 2, 3 points I have told you. Then I have told you control measurement point. Now this ND meridian, that is nerve degeneration meridian, it has two control points, CMP, control measurement points. There are two. One is here. This is ND1, and the first joint from below, if you come, then this is ND1A, which is SMP. SMP means total nervous system, autonomic nervous system, right? Which is automatically working. Hmm. And also the central nervous system, SMP. So this will have to be used. And then here only, this side is ND1A and this side is ND1B. So you have to use this, right? So whether brain tissues are softening or bacteria has got into it or uh, tissues have been destructed or there is a hemorrhage or there is a hematoma or white matter problem or gray matter problem, anywhere you can use it. So such explicit points were not available in TCM for nervous system. And nervous system is a control system. It controls the whole body. All the systems are being controlled by nerves. So I don't have to over stress the importance of these points on this meridian. बहुत ही important points हैं. इनको आप कहीं भी यूज कर सकते हैं. नर्व की जहां भी प्रॉब्लम है वहां यूज कर सकते हैं. तो सबसे पहले व्हाट वी विल डू, ये ND1 lumbar and sacral. Marrow means the marrow which is in spinal cord and brain. And nerves of lower extremity. वहां से क्या जा रहा है? लंबर और सैक्रल से कहाँ जा रहा है? It's going in the legs. So ND1 can be used for everything below the diaphragm, especially for legs, lumbar section, right? So, and sacral system region, whatever. Then comes ND1A. Should I show you the picture or you have you have the image? It has all been sent into your group. Now ND1A for both brain and spinal cord, again, all the central nervous system, everything, all autonomic nervous system. So all plexus, all meninges, for everything you can use it. So both parasympathetic nerves and sympathetic nerves. For both you can use. You know the difference between sympathetic nerves and parasympathetic nerves? Sympathetic nerves are the nerves which are responsible for increasing the blood flow, increasing the rate of uh, conduction of impulse, and parasympathetic nerves are those nerves which are responsible for dilating the vessels, blood vessels, and which are slowing down the uh, working, the function, right? So if you have high blood pressure, so it is because the blood vessels have been constricted. So what you should use? You should go to stimulate parasympathetic nerves. So full autonomic nervous system in which both the things are there, and then we go to the branch. If high blood pressure, parasympathetic nerve, that will dilate the vessels and the blood pressure will go down, right? And if the blood pressure is low, then SMP, that is ND1A, and then you go to parasympathetic nerve. Now, for sympathetic nerve, there is a point on stomach meridian, and for parasympathetic nerve, there is a point on gallbladder meridian. If you know these 2 points, then a lot of things can be done. If there is a person who has high blood pressure and you want to give him only 2 points, what will be that? ND1A, which is the total SMP, and then you will go to the parasympathetic nerves or sympathetic nerves. So what will you do? You will go to the sympathetic nerves or parasympathetic nerves. If you go to the sympathetic nerve point that is available in gallbladder meridian, that is gallbladder 20, you sedate it. And simultaneously, you go to the parasympathetic nerves, and that is stomach 10A. So it is between stomach 10 and stomach 11. This is a new point found by Dr. Wall. What will you do to ST10A? You will tonify. So parasympathetic nerve has to be tonified, sympathetic nerve has to be sedated. And what will you do with ND1A? Tone or sedate? Tone. Now GB20, you will stop it, you will sedate. So the stimulus will not go to sympathetic nerve. And ST10A you have tonified, so it will flow through that. So the blood pressure will go down. Are you getting it? ये नहीं है किताब में भाई. This is not there in the book. It's common sense. And Dr. Wall never used it and he has never given any formula. So you have to, like this, you have to uh, correlate and use it. वेंकटेश, you got it? आपकी समझ में आया? कुमकुमा.
Sir, excuse me, sir.
हाँ बोलिए.
Sir, with this we will use CMP also.
Yes, you can use CMP also. Yes, CMP should be used. But even if you do not use CMP, only if you want to treat the blood pressure, because the first thing that when the patient comes to you, you should take care of high blood pressure. Low blood pressures generally we ignore. It's not as dangerous. But if the patient is hypertensive, then you must. So there are a lot of points, a lot of methods. Even in TCM, we have so many things we can do. But this EAV is giving you only 2 points. You tonify ND1A and sedate GB20 and tonify ST10A. Simple. You can do it in Sujok also. In Sujok also. Anyway, then comes ND1B, which is CMP, control measurement point. Whether it is peripheral nervous system or central nervous system, anywhere, any problem with the nerves, CMP should be used. ND1B, where is this? This joint, you approach from top, this notch at yin yang border. If you care to see, I have shared an image. Then comes ND1C. This is for the meninges. You have three meninges in your brain, which is surrounding the brain, नहीं, जिसके अंदर the fluid is filled in and it is surrounding. Meninges are having gray matter where the impulse is generated. If the person is not able to move at all, so there can be because of two reasons. Either the impulse is not getting generated, or if the impulse is getting generated, then it is not reaching that particular point, legs or hands or eyes or ears or anything, which needs to move, right? So if there is a degeneration, if there is a malacia of white matter or gray matter, especially gray matter, then you should use ND1C. You might have heard about diseases of upper motor neuron disease, MND, motor neuron disease, upper motor neuron disease. That is gray matter. There you should use ND1C. Hmm? कुछ नहीं. Everything is going out of the reach of your mind. Huh? Not getting it? Have you seen patients bedridden who cannot move? I've seen such patients.
सर बेड क्लॉट
Bedridden. हाँ, सुना है? देखा है?
यस बेड सर क्लॉट होता है सर ब्रेन में क्लॉट होता है
Even clots you can use.
यस सर
There is a CMP, ND3 for the brain. 1, 2, 3. There are 3 points. ND3. Right? Anyway, ND2. This is especially for thoracic, upper thoracic, and also for cervical. So, and hands, especially for hands. This is measurement from. So you can combine this ND2 with TCM. In TCM, upper cervical, SI6 is the point. So you can use with SI6. Then I had told you something about lymph 6, if you remember. Lymph 6, which I had said that even if the breast has been cut off, and if there is a swelling or anything in the hand, a whole hand, there is a lymph. So you can use lymph 6. Then there are other points. We will see a regular meridian. On regular meridian, there is point for arteries, there is a point for vein, all that, whatever you think, right? And there is a point for tendons, muscles of hand. So with this nerve, you can use points for muscles, points for bone, points for arteries, points for veins. Because without nerve, nothing, all the systems are controlled by nervous system. With controller system, there are two controller systems, nervous system and endocrinal system. There are so many systems in your body. सबका controller कौन है? Nervous system and endocrinal system.
No.
Now, what is the difference between the two, nervous system and endocrinal system? The short term changes, आप बैठे हैं, उठ के खड़े होना है, नहीं? यहाँ फोन रखा हुआ है, this phone you have to lift. Then if you have to lift this phone, this you will need nervous system. But in case you want long term changes, you want some changes uh, which are unwanted changes. किसी को दाढ़ी मोछ आ रहा है, किसी लेडी को, किसी को हाइट नहीं बढ़ रही है. So, such long term changes, that is governed by endocrinal system, hormones. Short term movement of the body and mind, that is governed by nervous system. Short term changes, nervous system. Long term changes, endocrinal system. Then there is a point ND3. You can look at the image ND3. Where do you find ND3? ND3 you are finding in between on the metacarpal bone, where it is connected to finger. Knuckles. Knuckle है ना? Knuckle है. So if you come to this point, this is ND3. This is ND3A and this is ND4. So ND3 is measurement point for degeneration in the brain stem. Do you know what is brain stem? Brain stem is the junction of spinal cord and brain. The brain stem has three sections: midbrain, pons, and medulla. Midbrain, pons, and medulla. You might have heard that the right brain controls left side of the hand body, and left brain controls the right side of the body. You might have heard. So the nerves from this side goes to this side of the body, and nerves from this side of the brain goes to this side of the body. Where does it cross? It crosses near medulla. And that is known as pyramid. The brain and then this. So this is a kind of a pyramid. From right to left and left to right. Right? So remember, this you should remember. So ND3, ND3A and ND4 if you are using, you will use on the other side. When you will use this brain, this side will be paralyzed or whatever, affected. So, but that is not so in case of ND1, ND2 and ND3, up to ND2. ND1, 1A, 1B, 1C, all this on the same side, not on the other side. But when it comes to brain, it is on the other side. Is it all right? It's not very difficult. You know it already. Now, ND3 is for brain stem, that is, and cerebrum and encephalon. Encephalitis हो जाती है, नहीं आपको, जिसको बोलते हैं ब्रेन फीवर. Children die in our country. So many children every year they die because of encephalitis. There's no control, nothing. So there you can use ND3 for all the children. Now then there is another point, ND3A. So this treats
Yeah.
both parasympathetic and sympathetic nerves in cranium, cranial ganglia. Degeneration vessel point for cranial ganglia. It's written in your book. Especially parasympathetic nerve. What it will do, it will dilate. It will dilate the blood vessels going into the brain. Right? So if you think that the blood pressure has gone very high, you can use this also so that there will be safety and the risk of hemorrhage that will go down. नहीं किसी का सपोज ब्लड प्रेशर 220 225 50 ऐसा हो गया immediately you should use first as a safety process ND3A. कहाँ है ND3A? Between this and the junction of the two metacarpal. This metacarpal and this metacarpal, they are joining here, right? And this is the knuckle in between the middle point here on this bone. The image is with you. There is another point ND4, which is responsible for this another control measurement point. This is another control measure. ND3A is also control measurement point of parasympathetic ganglia of the brain. And ND4 is also control measurement point of the cranial nerves. There are 12 cranial nerves. Cranial means brain. Pertaining to cranium is known as cranial. Right? तो इसमें कौन कौन से नर्व है जो भी सिर में ना ऑप्टिक नर्व है olfactory नर्व है ऑडिटरी नर्व है ये these nerves which are coming from brain there are 12 right so olfactory nerve optic nerve oculomotor nerve trochlear nerve trigeminal nerve abducent nerve ये सब है facial nerve vestibular nerve glossopharyngeal nerve vagus nerve accessory nerve and hypoglossal nerve. There are 12 cranial nerves for which there is 1 point ND4. Now, the facial paralysis that is known as Bell's palsy, they are of two varieties. One is upper neuron variety, the lower variety, meaning thereby above the pyramid and below the pyramid. Right? So if the patient can close his or her eyes, or it cannot close. Look at that, find out, diagnose. If it is upper variety, then it will be on the contralateral side. Otherwise, it will be on the same side, excepting for this facial paralysis. You should use it wherever there is a clot. If the clot is on the left side, use it on the left side. If the clot is on the right side, use it on the right side. But if there is paralysis on hands and legs, etc., then you should use it on the contralateral side. अगर ये हाथ गया इसके मतलब क्लॉट जो भी है प्रॉब्लम वो किधर है इधर है सो जिस साइड का ब्रेन इन्वॉल्व है whichever side the brain is involved that side you should treat ND4 which is CMP of all the cranial nerves, which is responsible for olfactory nerve for smell, optic nerve for sight, right? Oculomotor nerve for eyes, trochlear nerve, again eyes, and trigeminal nerve. You know, trigeminal, one goes to eye, one goes to this jaw, and one goes to lower jaw. There are three branches from there, right? So, ye to, of course, you will have to study a little bit of nervous system so that you fully understand and can use it properly. This was about nerve degeneration meridian. These are the points only, ND1 to ND4. So CMP, ND4 is CMP, ND3 is CMP, and ND1B is CMP. There are three CMPs, right? So ND3A, which is again a CMP, is for parasympathetic ganglion. Meaning thereby, parasympathetic means this will dilate, right? Then comes allergy or vascular degeneration vessel meridian, which is in short known as AD meridian. Now, AD meridian is in the middle finger, this side. You see, the pericardium comes from here and it goes from thumb side. But this side is vacant. This side में कुछ नहीं है. So this side is AD meridian. AD1, it starts from here. AD1B is this. So what is allergy? If someone asks you what is allergy? So allergy is what? If the immune system of your body, if that starts behaving abnormally, what is immune system? Lymphatic system. If that behaves abnormally, means that is not working, that is not eating up the foreign material, the microbes, the viruses, etc. Right? So that will harm the tissue of vessels in which the lymph or the blood is flowing. Remember, in the blood also you have white blood cells, and in the lymph also you have white blood cells. So the vessels, they will start showing lack of function. If their function goes down, right, then there will be a lot of problem. Lot of problem means either the blood will not reach, or it will reach and it will get stuck, or the hands, some kind of reaction, reactionary phase, excretory phase, and then the second phase of the disease is reactionary phase. Reaction. So reaction means either the temperature will go high, or the pH will go high, or temperature, pressure, and pH. Homeostasis. So homeostasis will be disturbed, and that will disturb the walls of the vessel, because walls are also made of tissues. Vessel walls. Which vessels? Blood vessels and lymph vessels. So if the vessels don't work, even nerves will not work. Especially, do you know blood flows in your blood vessels? Do you know how? In the blood vessels, there is innervation. There is a kind of a peristaltic motion in all the blood vessels, especially arteries. Arteries require that peristaltic motion, which comes through nerves. If these tissue of the walls of blood vessels, if they are reacting and misbehaving, then this action will be jeopardized. And if the blood is not flowing and reaching the point where you want to work, so you will not be able to see properly work. But if this happens, this will happen horizontally. This will appear, the symptoms will appear. The reactionary symptoms may appear on the skin. It may appear especially in the skin or any other portion, because what is that? What is it? Either temperature or pressure or pH. So that may appear as blisters, that may appear as any kind of no, what do you call it? Small uh, granules or something like that. It can appear like that. Even urticaria kind of thing, right? So there you should use wherever there is a manifestation of the symptoms of disease is horizontal, you should take it that this is kind of an allergy because the walls of blood and lymph are not working properly. Because the walls of the vessels are also tissues, isn't it? Why? Okay. Maybe some chemicals have come in through blood and it has affected those tissues or whatever. So in such cases, the points of this meridian can be used. So vascular degeneration, therefore the name is vascular degeneration meridian or allergic degeneration. So today you have understood what is allergy. Generally, the allopathic doctors, they won't be able to explain what is allergy. Allergy hai. They will say this allergy. क्या है? What is allergy? Allergy is the cells of the tissues of the vessels are reacting. Reacting why? Because some chemical, some foreign material, something. What is happening? Either the temperature is going on, there is a swelling, there is an inflammation, or the acidity or the alkalinity has increased or decreased, or the pressure. ठीक समझ में आ रहा है? So there can be two things. Either you have taken some food which has appeared as a reaction, which has reacted, or you have taken some medicine or chemical which has manifested as reactions. So in both cases, you should use it. All kinds of food stuff, chemically treated carbohydrates like grain, rice, potatoes, vegetables, fruit juice, पूरा list है. नहीं? These causes of allergy, different types. Insecticides, herbicides, anything can come in with your food and nourishment. This can cause oral cavity allergy also. Now the points. ND 1, 2, 3, you remember. 1 means below the diaphragm. 2 means up to neck. And 3 means head. So ND, AD1. How the points are named? AD. A for apple, A for aeroplane. D for degeneration. AD. So AD1. Look at your image so you will know where is the location. If you have any difficulty in locating, which is not there, I don't think you will have difficulty in locating these points. ये points आराम से मिल जाएगा, कोई दिक्कत नहीं है. नहीं, नाखून के साइड में. इमेज दिखाई दे रहा है कि नहीं आपको? Image, I have sent the image of all these meridians in the group. Can you see that?
Yes, sir. We can see it.
हाँ. तो एलर्जी अगर लोअर एक्सट्रीमिटी में है या एब्डोमिनल में है, पेल्विक एरिया में है, सब में ND1 लगे, AD1 लगेगा। क्या करेंगे? टोन करेंगे कि सेडेट करेंगे?
sedate,
सेडेट करेंगे। एलर्जी इज ऑलवेज एक्सेस, एक्सेस ऑफ टेम्परेचर, एक्सेस ऑफ एसिडिटी, एक्सेस ऑफ प्रेशर। सो व्हाट विल यू डू? sedate. Allergy and lymph, you should sedate. Then comes AD1A. This is irritation of autonomic nervous system. अभी हम लोग पढ़ रहे थे ऑटोनॉमिक नर्वस सिस्टम, एनडी मेरिडियन से करते हैं, एडी से भी करते हैं। Because neurons can also react. They are also made of, especially the myelin sheath over the neurons. If myelin sheath has got reacted, if their temperature has gone up, if their cells in that particular tissue is reacting, then they will not function and the impulse will not flow properly, and therefore you should use AD1A. This is measurement point of allergic irritation on autonomic nervous system. Autonomic nervous system is total brain and total spinal cord, right? Then comes AD1B, which is CMP of allergy throughout the body. पूरी बॉडी में कहीं भी एलर्जी हो, AD1B कंट्रोल मेजरमेंट पॉइंट। CMP कहाँ है? सेम
yeah,
ऊपर साइड, दिस मिडिल जॉइंट, यिन यांग में, वेयर देयर इज ए नॉच। ये पतला बोन है, दिस इज थिन, एंड दिस अगेन बिकम्स a little broader. So in this notch, AD1B. Then comes AD1C. Now this is SMP. For what? For arterial and vascular sclerosis. Sclerosis, do you understand what is it? The vessels are not getting the impulse. So if it is not getting impulse, what will happen? It will not function, right? So neither the blood is flowing nor the neural impulse is flowing. And it becomes very, very difficult. Arterial sclerosis means what? That it will just not function and a person can die. He will not be able to speak, he will not be able to walk, he will not be able to think. So this is a very dangerous point. But this arterial sclerosis of vascular sclerosis, vascular means what? Arteries and also veins, they are not receiving any kind of impulse or any kind of nourishment. तो क्या होगा? Nourishment नहीं मिले किसी को तो क्या होगा? What will happen if you don't get the nourishment? You will start dying, isn't it? And because the fluid will also not reach, because the fluid reaches through blood only, and the peristaltic motion has gone. And allergy why it has gone? Because there is some kind of allergy. Allergy in what? In that particular tissue by virtue of which these vessels are made. जो दीवाल है वेसल की, ब्लड वेसल की, है ना, लिम्फेटिक वेसल की, इसमें एलर्जी हो गया, ये रिएक्ट कर रहा है। क्यों रिएक्ट कर रहा है? कोई केमिकल आ गया है या कुछ खाना खा लिया, कुछ समथिंग Generally, it is reaction only. So this is a very difficult disease which is slowly appears. A long term problem आता है, धीरे धीरे आता है, और जब आता है this becomes very difficult to treat. So a good point is AD1C, which is SMP, anywhere in whole of the body. Any kind of sclerosis. In such cases of sclerosis, sclerosis means not functional, very loose, बिल्कुल खत्म, एक होता है, और दूसरा क्या होता है, वेरी टफ, नो elasticity. Sclerosis means the cells are dying or dead. So in terms of yin yang, what is it? It is excess of yin, excess of yin. So this is also a case of excess. So what we should do? AD1C should be sedated. So even when the arteries are blocked, this sclerosis can happen. Because if the arteries are blocked, the blood will not flow. Then also nourishment will not reach, and the cells will start dying. That is known as sclerosis. AD2, this is measurement point of allergies of the upper portion of the body, including organs of the body of the things which are above the diaphragm. So chest, throat, skin hole, chest hole, allergy of upper portion of the back, neck, upper extremities, even in asthma, allergic asthma. Have you heard? Allergic asthma. What you should use? AD2. AD2. With all the TCM points, you should use AD2. You can use LU11 also, and so many other points, but you should use AD2 because allergy means generally we associate liver with the chemical reactions. So in allergy, you never forget to treat liver and spleen. And if the allergy is in the lungs, then the wind point in lungs is LU11. So thinking of all that, you can always combine TCM with these points. So don't depend only on AD2. You can use lungs point, you can use liver point, you can use LU11 is what? According to BG meridians, LU11 is dryness of liver. Shiva. Right? They were not able to explain. You can explain, I can explain because we know BG. So this is liver again. LU11 is dryness in liver. What you can do? You can sedate. So respiratory organs, myocarditis. Myocardium. Myocardium is muscle. Especially myocardium is very thick in the left ventricles, right? And mostly the heart failure means the myocardium is failing. Myocarditis means there is an infection in those muscles which are responsible for the function of left ventricle. लेफ्ट वेंट्रिकल को फंक्शन करने के लिए मायोकार्डियम चाहिए, मसल्स चाहिए. अगर उसमें चला गया, एलर्जी हो गया, उसमें इन्फ्लेमेशन हो गया, तो वो काम नहीं करेगा. और क्या होगा? तमाम ब्रेन में भी प्रॉब्लम होगी, हाथ पैरों में भी प्रॉब्लम होगी. एलर्जी ऑफ द स्किन ऑल्सो, 82. एनी एलर्जी, skin allergy of the upper extremities, neck or nape. So इस तरह का एलर्जिक एस्थमा में you can use with lungs point, you can use this AD2. Which area? Above the diaphragm up to the neck. Then comes AD3. AD3 is allergy of the head area. So it is the skin in the head area, organs of the head, nose, allergies of the nose, all this, and then allergy of the parasitous sinuses, face, hair. Dental problems may you should use both AD3 and lymph 2. Lymph 2, I have said this was lymph of the odontons, teeth, and AD3 is this area, allergy. So when there is a problem in teeth, you should use this first lymph, and then you can use AD3. Where is that? AD3 is this knuckle. This is the AD meridian. You come to this knuckle, and from this side, this is AD3. This is AD2, and this is AD3. So this is AD meridian 1, 2, 3. What should you do? You should sedate. Always use the CNP with any 1, 2, 3. Whichever point you are using, use CNP also. Right? And AD1C is the SMP, especially for arterial and vascular sclerosis. Okay. So, battery. So this is, then comes,
Sir, I can't find AD1C.
you can't find AD1C. Have you seen the image I have sent in the group? AD1B. 1C is there in that group. Yes. Oh,
AD1C is there?
ah, AD1A it is written.
And I am little confused why the order is changed also.
No, no, I shall tell you what it is. So make that A, you make it as C. And AD1A is like ND1A. So that point is not shown in this image. This image is, people have been just copying it.
Okay, sir. Okay, sir. Understood.
So where you will find ND1C here. This is not shown. This point is not shown. So this is 1, this is 1A, this is 1B, and this is 1C. 1, 1A, 1B, 1C. Please note, I was also incorrect in the first go. 1, 1A, 1B, and 1C. So 1C is 1 where they are showing 1A. That is 1C. Okay, is it correct now? All of you have corrected it. So correct it. A, B, C. After 1, it will come 1A. then it will come 1B, then it will come 1C. That is the sequence everywhere. I also didn't care. I also didn't notice it. It's good that you
सर
noticed
बुक में
it.
करेक्ट है सर। सर बुक में
हाँ,
करेक्ट है सर।
बुक में
बुक
करेक्ट है।
में करेक्ट है। बुक में करेक्ट है, करेक्ट है।
करेक्ट है। अच्छा, ओके।
हाँ करेक्ट है सर, बुक में करेक्ट है।
अच्छा, ठीक है। हाँ, बुक में तो है। बुक में करेक्ट है। ठीक है, यस, बुक में करेक्ट है। दैट बुक मीन्स treatise 3. Treatise 3 has gone to you, so that is correct. So 1, 1A, 1B, and 1C. Then comes 2, then comes 3. Right? रिनिटिस वगैरह हो जाता है ना, किसी को नाक के पानी हर समय, सुबह मॉर्निंग उठो तो छींक फींक आ रही है, स्नीजिंग राइट इन द मॉर्निंग, हाक्शी हाक्शी. दिस 83 वर्क्स वंडरफुली वेल.
सर उसके साथ ऑन 83 का सर।
लिवर करो यूज, लिवर 3.
लिवर।
एनी एलर्जीज विद लिवर, liver and spleen, don't forget it. Spleen tone, liver sedate. Spleen tone, liver. So liver 3 sedate, sp3 tone. That you can do. समझ में आ रहा है कि नहीं वेंकटेश? दीज आर ऑल वेरी कॉमन सेंस. लगा के इफ यू कैन यूज इलेक्ट्रोएक्यूपंक्चर पॉइंट्स, इट्स वंडरफुल. इतना जबरदस्त रिजल्ट मिलेगा, तुम सोचोगे नहीं फॉर्मूले के लिए. हमको मिला
सर
है. आई हैव एक्सपीरियंस्ड इट, देयरफॉर आई एम टेलिंग यू. आई एम कन्विंस्ड. लेकिन सिंगल खाली इलेक्ट्रोएक्यूपंक्चर यूज करके बहुत सा कभी कभी मिल जाता है रिजल्ट, लेकिन ऑलवेज यू डोंट गेट दैट. यू शुड ऑलवेज ट्राई टू कंबाइन. I'm telling you this because I have found that independently electroacupuncture points may not work in some cases very well, but if you are using it with the regular meridian points, where also Dr. Wall has given so many points, he has redefined. जिस पॉइंट को कुछ और बोलते थे उसको उन्होंने और कुछ बोला. Same point he suggested that this is meant for something else, not like Chinese have said. This is known as redefining the same point. I give you an example, H8, I remember. So he redefined K1, he redefined H8A, he redefined H8 को redefine किया. तो ये सब देखना चाहिए. Then the next meridian is organ degeneration vessel or parenchymal and epithelial degeneration. पेरेंकाइमा किसको कहते हैं? पेरेंकाइमल मीन्स पर्टेनिंग टू पेरेंकाइमा. पेरेंकाइमा कहते हैं वेयर those cells of any organ which are responsible for maximum function. कहाँ होता है? कॉर्टेक्स में होता है. कहाँ होता है? कॉर्टेक्स में होता है. हम्म, ठीक. अच्छा, कॉर्टेक्स में होता है माने फंक्शनल टिश्यू है, ऑर्गन का वॉल है, दैट इज पेरेंकाइमा. या न्यूरॉन है, या नेफ्रॉन्स है किडनी में. तो ये सब जब डिसफंक्शनल हो जाते हैं, इसको बोलते हैं पेरेंकाइमल डिसफंक्शन. ये कब होगा? ये तब होगा जब व्हेन द डिजीज हैज क्रॉस्ड द डिपोजिशन स्टेज, इम्प्रेग्नेशन. When the foreign material, the toxins and the infecting material, the foreign material that has got inside, उसने पेनिट्रेट करके ऑर्गन में घुस गया. अब ऑर्गन काम नहीं करेगा. ऑर्गन काम नहीं करेगा माने फिर अल्टीमेटली क्या होगा? कैंसर होगा. अल्टीमेटली व्हाट विल हैपन? एट्रोफी, नो वर्क, नथिंग, एवरीथिंग डेड. सारा एनर्जी द फॉरेन मटेरियल विल टेक एंड द ऑर्गन विल डाई. सच ए सिम्टम मीन्स, हम इसको चाइनीज में क्या कहते हैं? कोलैप्स ऑफ ची. deficiency of chi, sinking of chi, and collapse of chi. Deficiency is only deficiency. Sinking means what? Degeneration. And collapse means what? Atrophy. Atrophy means dead, finished. समझ में आ रही है? So this situation, parenchymal and epithelial. Epithelial means parenchyma. Oh, epithelial means those cells which are making the tissue. That is known as epithelial cells. Many cells coming together, joining, they make tissues. वो सेल को मार दे रहा है, उसको बोलते हैं इपिथेलियल डिजेनरेशन. ये स्टार्ट हो गया तो बहुत डेंजर 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 में आ गया. ऑर्गन ने काम करना बंद कर दिया. ऐसी जगह में क्या करेंगे? जो इपिथेलियल सेल में चला गया, टिश्यू में, बॉडी, वो जो ऑर्गन का वॉल है उसके बॉडी में चला गया ऑर्गन में, उसको निकालना है. कौन करेगा? डीप लिम्फ. वो लिम्फ वाली मेरिडियन नहीं करेगी, डीप लिम्फ करेगी. उसको क्या उन्होंने ऑर्गन डिजेनरेट करना शुरू कर दिया. माने ऑर्गन का फंक्शन कम होना शुरू हो जाएगा, बाद में मर जाएगा ऑर्गन, पूरी एट्रोफी, उसके बाद कुछ नहीं होगा. यू कैनॉट गिव न्यू लाइफ. लेकिन जब शुरू हुआ, यू कैन ऑलवेज ट्राई. ओ आर पॉइंट्स लगा. ओ आर मेरिडियन कहां है? यहां पर ट्रिपल वॉर्मर मेरिडियन है. एंड दिस साइड इज ओ आर, खाली जगह में. So OR meridian, organ degeneration meridian. This treats parenchymal and epithelial degeneration. सेलुलर लेवल का वो स्टेज जिसको आप अभी भी बचा सकते हैं. यू कैन सेव, देयर इज अ चांस. यूज ओआर. एक बार डेड हो गया, मर गया, कैंसर से मर गया, किसी चीज से, तो देन इट इज नॉट पॉसिबल. Just before it is dying, or maybe some cells have died and some cells are still living. उस टाइम में उसको साफ करो, क्लीन करो, तो उसको नरिशमेंट जाएगा, ऑक्सीजन जाएगा, इट विल रिवाइव. आर यू अंडरस्टैंडिंग?
Yes, sir.
जो फॉरेन मटेरियल है, ऑर्गन का दीवार और ब्लड वेसल्स दोनों के बीच में क्या है? फ्लूइड है. ऑर्गन और फ्लूइड, अब जो मटेरियल आ रहा है, ब्लड के साथ में मटेरियल आ रहा है, और वेस्ट मटेरियल ब्लड में घुस करके रिटर्न हो जा रहा है, और जो नरिशमेंट है वो ब्लड से ऑर्गन में चला जा रहा है, और वेस्ट मटेरियल ऑर्गन से ब्लड में चला जा रहा है. जो ब्लड में नहीं जा पाया वो लिक्विड में, दोनों के बीच लिक्विड है, वहां पर डिपॉजिट हो गया. बाद में वो क्या किया? वापस ऑर्गन के वॉल, दीवार में, पेरेन्काइमा में, सेल्स में, इपिथेलियल सेल्स में घुस गया. घुस गया तो सेल्स मरने लग गए. सूरज, आर यू गेटिंग इट? एकदम बिल्कुल लेमैन लैंग्वेज में, एकदम हिंदी में बता रहा हूं आपको. अभी तो ये शुड नॉट बी वेरी डिफिकल्ट टू अंडरस्टैंड. आर यू ऑल गेटिंग इट?
Yes, sir.
पवन, ठीक है?
यस सर.
ऐसे केस में उस दीवार के जो थिकनेस है उसमें घुस करके उसके सेल्स को से निकालना अगर है, तो डीप लिम्फ जो है वहां तक पहुंची हुई है, वो निकालेगी. वो है ओ आर मेरिडियन, ऑर्गन डीजेनरेशन वेसल, और पेरेन्काइमल एंड इपिथेलियल डीजेनरेशन. सेलुलर लेवल का लास्ट बट वन स्टेज है, फिफ्थ स्टेज. इवन इन सिक्स्थ स्टेज यू कैन यूज इट. चांस है तो ठीक हो जाएगा. राइट? तो कोई ट्यूमर बन गया, कैंसर बन गया, इसको जरूर लगाने का. ओ आर मेरिडियन है ना. लास्ट स्टेज एंड लास्ट बट वन स्टेज, ओ आर मेरिडियन. ये सब का इतना क्लियर कट पॉइंट्स तो नहीं मालूम थे ना टीसीएम में. हम लोग जाते थे कैसे भी करके, कैसे भी. अभी बीजी मेरिडियन में, बिकॉज वी हैव हॉरिजॉन्टल मेरिडियंस एंड ऑल दैट concept, okay, it is there, but why not use these things also, which the modern science. But what he did, Dr. Wall connected the Chinese system with the modern medicine, isn't it? That's all he did. मॉडर्न साइंस। और वो ये पॉइंट से ये होता है, ये पॉइंट से ये होता है, ये पॉइंट से ये होता है। द lymph inside that is activated by these points. Lymph outside that is activated by these points. डिपोजिशन स्टेज तक लिम्फ काम करेगा। डीप लिम्फ will still work even after impregnation has started. Now, epithelial degeneration generally happens in the walls of hollow organs like intestines, bladder, uterus, vagina, ureter, urethra, because they have three layers uh, of muscles. All these have three layers of, and if you add mucus, then there are four levels wherever there is mucus. So the deep layer is known as epithelium or endothelium. So impregnation जब हो गया मरने लगे, मरने के कगार पे हैं, the organ is about to die. Saving grace if the God willing, if the patient comes and you find that tumor हो गया, गांठ हो गई, some node is there which is not going, maybe it is cancerous. उसको तो बायोप्सी करेगा तभी मालूम पड़ेगा. After biopsy only they will know whether it is benign or malignant. ओ और मेरिडन, यू शुड स्टार्ट यूजिंग, बोलो उसको लगाओ, 20 घंटा 24 घंटा लगाओ. Hmm? Do you think he has done a wonderful job, Dr. Wall? What a discovery! What a thing to suggest. ऐसा एक्सप्लिसिट ये पॉइंट बोल के कैंसर में लगाओ, ऐसा तो नहीं है ना. दिस इज नॉट देयर इन टीसीएम, नो. ओके, सो again you look at the image, organ degeneration vessel. Organ degeneration meridian में OR1 is measurement point of parenchymal degeneration, changes of all organs in the abdominal and pelvic area, that is lower portion below the diaphragm. पैर वैर में कुछ बात है ही नहीं. ऑर्गन्स की बात है. ऑर्गन कहाँ है सारे? इन योर बॉडी. सो पेल्विक एरिया में क्या है? यूरोजेनाइटल एरिया. एंड एब्डोमेन में क्या है? इंटेस्टिन्स. एंड डोंट फॉरगेट टू यूज CMP. नहीं, किसी किसी को क्या होता है, इंटेस्टिनियल कैंसर हो जाता है, एनल कैंसर हो जाता है. बहुत कठिन होता है. इट्स वेरी वेरी डिफिकल्ट एंड पेनफुल डेथ. दे सर्जरी में गए तो फैल जाता, मेटास्टेसिस हो जाती है. मेटास्टेसिस माने सारे कैंसर सेल्स दे विल स्प्रेड ऑल अराउंड, इसको बोलते हैं मेटास्टेसिस. मेटास्टेसिस हो गया कैंसर में, देन यू कैन नॉट बी सेव्ड बाय एनी एलोपैथिक थिंग्स. सो बिफोर सर्जरी देयर आर स्टिल चांसेस. क्या? डीप लिम्फ अगर वो इनसाइड गया है, इन द वॉल्स, हॉलो ऑर्गन्स के वॉल्स में गया है, तो यू शुड यूज OR1. तो सारे पेल्विक एरिया के ऑर्गन एंड एब्डोमिनल एरिया के ऑर्गन. तो किसी को बहुत ज्यादा कब्ज है, किसी को फाइब्रॉइड हो गया, वो ठीक ही नहीं हो रहा है, यूट्रस में फाइब्रॉइड हो गया, यूट्रीन में फाइब्रॉइड हो गया, ऑल दीज डोंट फॉरगेट टू यूज OR1 विथ CMP. नहीं, ऐसा जब होगा तो सबसे पहले क्या होगा? 3 3 4 4 5 5 दिन तक देर विल बी नो, स्टूल विल नॉट पास. ऐसा भयानक कब्ज हो जाए, कॉन्स्टिपेशन हो जाए, This point will work. So even in chronic constipation, before that stage comes, you can use these things, these points. There is no harm in using this point because this is only cleaning. This is only cleaning, so there is no harm. साइड इफेक्ट नहीं है इसका कुछ, कोई रिएक्शन नहीं होने वाला है, कोई एलर्जी नहीं होने वाली. OR11 is again lymph. OR1 and OR11. OR11 is at the distal joint from top. And if you go halfway, halfway means here, this OR1, this OR11. OR1, OR11. OR11 is lymphatic burdening from cellular degeneration or organ degeneration और पेरेंकाइमल डिजेनरेशन के लिए OR1. OR1A is measurement point of organ degeneration due to autonomic instability, meaning thereby every organ is innervated. Nerves are going from spinal cord to every organ. Large intestine, small intestine, uterus, everywhere. Nerve is everywhere. If that is getting degenerated, nerve is getting degenerated, OR1A. OR1A, always you remember, this is nerve point, innervation point, har jagah, everywhere you will find. And 1-1 is everywhere lymph. Even in regular meridians, at these position, oh, any 1-1 point is lymph and 1A at this particular point topographically, whether in the toes or in the fingers, right? So the position of 1-1 is always about lymph and position of 1A is always about nerve. Remember this. This is nerve. And then comes CMP. 1B is CMP of organ degeneration, entire organ system excluding endocrine glands and mammary glands. मेमोरी ग्लैंड्स में काम नहीं कर रहा है और एंडोक्राइन ग्लैंड्स में काम नहीं कर रहा है, राइट. OR1C, दिस इज फॉर होल ऑफ द पेरिटोनियम. पेरिटोनियम क्या है? आपके एब्डोमेन में एक there is a membrane which is covering all the organs together. All the organs are within peritoneum excepting for uterus. So OR1C. Then OR1D is for pleura. Pleura means there are layers, two layers of lungs. As I told you, the pleurisy and pleura. Did I not tell you? I told you that, right? So in that case, you can use it for OR1D. So first you will use lymph and then you will use this OR1D. OR2 is degeneration of organs in the chest and neck. And OR3 is degeneration for the head. So any tumor, any cancer in the head, what will you use? OR3. कोई गांठ हो जाए, right? Even if there is a inflammation, swelling, hematoma है, उसके लिए भी OR3. What will you do? Sedate or tone?
Correct.
हैं? What will you do? Tone करेंगे कि sedate करेंगे? शिवा, no idea?
सर टोन सर इन एक्सेस है ना सर,
हैं?
गा टोन करना सर.
बहुत गलत. Lymph will always be sedated. You are cleaning, बाबा. कितना बार बताया?
सर गाट मानो इन एक्सेस बोल के हो.
गांठ मीन्स क्या हो गया?
हाँ,
कोई चीज इकट्ठी हो रही,
हाँ,
उसको हटाना है ना, वापस
हाँ,
एक्सक्रीट करना है ना, निकालने है ना।
yes, sir.
सेडेशन, दैट इज अपोजिट फ्लॉ। बेसिक्स जो चाइनीज का है वो भूलना थोड़ी है, वी डोंट हैव टू फॉरगेट इट। अब डॉक्टर वॉल तो बोलेगा नहीं सेडेट करो कि टोन करो, उसको नहीं मालूम। डॉक्टर वॉल विल नॉट टेल यू व्हाट दिस ओनली टीसीएम। जिसको मालूम है यिन यांग का बारे में मालूम है, वही बताएगा क्या करना
Yes,
होगा।
sir.
तो लिम्फ मेरिडियन,
Correct, sir.
एलर्जी मेरिडियन, ओआर मेरिडियन, सारे पॉइंट्स क्या करेंगे? वी विल सेडेट इट,
Correct.
सेडेट इट। उसके बाद के पॉइंट है कि जिनकी फिंगर्स वगैरह कटी हुई होती हैं, वो लोग OR4, OR5 एंड OR6 दे कैन यूज इट, विच इज नॉट देयर ऑन द फिंगर्स बट समवेयर एल्स। फिंगर्स नहीं है। OR3, 4, 5, 6 आप देख लेना इमेज में, है ना। OR4 जो है एब्डोमिनल पेल्विस नीचे के लिए है, OR5 जो है वो चेस्ट और नेक के लिए है, एंड OR6 इज फॉर द हेड। So these are all the tissue meridians which are in your fingers. And tomorrow we shall take up the meridians of your toes. Okay? बहुत बात तो
Yes,
आज
sir.
ही बता दिया है। टोज वाला बहुत जल्दी हो जाएगा बिकॉज सिमिलर रहेगा, दैट विल बी सिमिलर, सो इट विल बी वेरी फास्ट। And then we will take organs and its different parts and regular meridians and how they are. That also we will touch all the important points we will touch. There are nearly 275 points which Dr. Wall came up with. So uh, we will see that, and most probably tomorrow we will do it. Toes. We will take up the toes. Okay.
Yes. Next.
Kal. So tomorrow we'll meet.
Yes.
We'll do it. Anything you want to ask?
Can I ask
हाँ
one
बोलो.
question?
Yes, go ahead.
Yes. Sir, like we are mentioning like tonification, sedation, but with respect to wall, how the because we are not sure about the direction of chi with respect to
We are
wall, right?
not using there. See, tonification is of three varieties. Sedation is also of three varieties. We have discussed it in level 1 and level 2 very thoroughly, especially in level 2. Nobody knows about it. Nobody talks about it. But I have discussed in level 2 time and again. There are three ways of tonification. Tonification means what? Spreading the thing is spreading the chi. It's tonification. Bringing the chi together. So one is like this, without direction. One is along the flow of the chi in the meridians. So the meridians concept is not there in EAV. EAV is, I have told you, in five element theory cannot be used, isn't it? The very first day when you ask this question. And another tonification is transferring the chi from lower phase to upper phase. These are the three tonifications which you should know. Which tonification do you think we can use in electroacupuncture?
Threading?
This one.
Yeah.
Only round magnets.
Oh, okay. So we can't use needles.
You can use needles, no problem.
Then if you use needles means renting only.
Renting only. Yes, you are right.
Okay.
Because chi has its own wisdom and intellect.
Yes.
You have to only stimulate.
Yes.
Because we are using magnets, right? I myself is not very conversant with, not very comfortable with needling. I don't needle to my patients. Yes, in my family, I'm doing it. See, because I can get into legal affairs, which I don't want to.
Yeah, and I
I'm not a
understood.
doctor. I'm not a doctor.
Yes.
No.
Sir, and one more question, sir. Like you are saying, like opposite flow sedate
Mhm.
in EOV points also. Opposite flow sedate. Sedate in opposite flow. Like that.
You ask me BG Meridian.
So in okay, here in EAV, no, sir.
There is nothing like opposite flow in EAV.
Okay, sir.
Electroacupuncture does not talk of any. Opposite flow is something very, very special. If you know opposite flow, you are so powerful. Even if EAV is not there, you can
Okay.
do a lot.
Sir, just to confirm, like sir, tonification in normal flow is equivalent to sedate in opposite flow. Both are same. Am I right, sir?
Maybe, yes, most of the time. Most of
If you say most of the time means when, that is not correct, sir.
come to BG Meridian, pay for it. How shall I survive? My bread and butter. I must get my bread and butter, isn't it?
Okay,
And
sir.
if
Okay,
you
sir.
have difficulty in paying, tell me that you have difficulty in paying, and then you know that I shall not ask for money. But you should be genuinely interested in learning. You can learn for free also. No problem. Especially for people like you
Like,
who have been coming and repeating every class. So Shivangam, if you have a problem with money, you must tell me. Never worry. But those who are coming for the first time, second time, why should I consider? But if they have a problem, I have considered many places, many a times. Okay. And those who are repeating always half, 50% goes for discount. Sure. Okay. Good night then.
thank you.